Why are my liver function tests not improving? If you are wondering why your liver function tests are not improving, you are not alone. Liver function tests, often called LFTs, measure various enzymes and proteins in your blood that reflected your liver's health. These include alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, gamma-glutamyl transferase, bilirubin, and albumin. When these tests show abnormal results, it can be concerning, especially if they do not improve over time. One reason your LFTs might not be improving is due to persistent liver disease or damage. Conditions like metabolic-associated steatotic liver disease, which used to be known as non-alcoholic fatty liver disease, alcohol-related liver disease, chronic viral hepatitis, autoimmune hepatitis, and certain hereditary conditions can all lead to elevated liver enzymes. If these conditions are ongoing or not adequately treated, your LFTs may remain as abnormal. Another factor could be continued exposure to liver stressors. If you are taking medications that can harm the liver, consuming alcohol, or being exposed to other toxins, this can prevent your liver from healing. Stopping these stressors often leads to improvement in liver function tests, but ongoing exposure keeps levels elevated. Chronic or advanced liver fibrosis and cirrhosis can also play a role. When liver damage progresses to fibrosis or cirrhosis, the liver's ability to regenerate and function properly declines. This can keep your LFTs elevated or cause them to fluctuate. Non-invasive markers can help indicate advanced fibrosis, which correlates with persistent abnormal tests. Inadequate treatment of liver conditions can lead to ongoing liver inflammation, keeping your LFTs abnormal. For example, if you have viral hepatitis and do not achieve viral suppression, this can lead to continuous liver cell injury. Similarly, untreated autoimmune hepatitis or metabolic liver diseases will also keep your liver enzymes high. Sometimes, LFTs may show transient elevations due to minor, reversible issues like infections or temporary medication effects. However, if your LFTs remains elevated beyond 1 month, it suggests a more persistent liver problem that needs further evaluation. Additionally, other medical conditions outside the liver can influence liver enzymes. Muscle injuries or bone diseases can affect certain liver tests. Systemic illnesses that cause inflammation can also complicate the interpretation of your results. Lastly, laboratory and biological variability can affect LFT results. Fluctuations can occur due to differences in lab assays or sampling errors. It is often recommended to repeat tests over time before concluding that liver function is not improving. If your LFTs are persistently abnormal, healthcare providers will typically review your medication and alcohol history to identify ongoing liver insults. They may conduct a detailed evaluation, including viral serologies, autoimmune markers, and imaging studies to identify specific causes. Assessing liver fibrosis severity through non-invasive tests or biopsies may also be necessary. It is essential to monitor trends in liver function tests rather than focusing on isolated values. This helps guide treatment decisions. From the perspective of liver health and liver cancer, persistently abnormal LFTs warrant careful assessment. Chronic liver injury increases the risk of fibrosis, cirrhosis, and hepatocellular carcinoma. Early diagnosis and management of underlying causes are crucial to improving liver function and reducing cancer risk. Always consult with healthcare professionals to interpret your LFT results accurately and determine the appropriate next steps based on your individual health status.